one is another one of our academic videos for the Academy of Amateur Foot and Ankle Surgery. This video is basically, we're going to just do a testimonial here on the HyProCure implant. Now, I don't have any financial, connection to the HyProCure. I do speak for HyProCure implant and have endorsed the implant. So this is a patient that's 1 year later. I want to show you this patient. One of the things we run into when we're discussing the HyProCure implant and sinus tarsus implants in general is often people think they're only for children, but they can be used in adults and older patients as well. Let me show you this patient's foot. If you come over on the side here, Carl, you can see where we made a fairly small incision here on her foot, and this is where we placed the stent in her foot 1 year ago. Now, she had a lot of issues with her foot. If you look at her foot now, if we get her foot in neutral position and press up on her foot, if you look at this angle here, you see she gets about 3 degrees of pronation in the forefoot, which is what you're kind of angling for in the HyProCure. Now, if you look at her overall foot here, you can see she has a lot of arthritis in her foot, so she's not really the best candidate for HyProCure. What she actually had was a posterior tibial rupture in her foot. We tried a lot of different modalities for her. We tried orthotics. We definitely tried the AFO brace, and she just kept getting worse and worse. And we discussed different treatment options for her, including more extensive surgeries. She has some responsibilities that makes it where she needs to get back to normal fairly quick. So she couldn't really go through a year of recovery or anything like that. So we chose the HyProCure on her, even though she wasn't the best candidate for it. And this was a very successful surgery. You see now she has a lot of stability in her foot, and we'll just let her talk to you about that. Now here's our patient here. Let me ask you this: with the HyProCure, are you happy with your surgery now?
I'm very happy.
Okay. You having any pain at all with your foot?
No pain at all.
That's a good testimony. Now let me ask you this: with your recovery from this surgery, how long was your recovery from this? How long did it bother you after surgery?
Probably 3 to 4 weeks.
Okay, so that's a pretty quick recovery. If you were to compare that to some of the other things that we could have done for her, the recovery would have been a lot more extensive. So with her, she needed to kind of get back on her feet quick. She didn't have a lot of people to take care of her here, and she has other responsibilities where she has to take up care of other people. So basically, this was a good choice for her, and we just wanted to let everybody know that the implant can be used in adults and in children, not just for children. It's a very good procedure, very high success rate. This is a confirmed tibialis posterior rupture patient, and after the surgery we did place her in a cam walker to rest this area, and she did very well. This is 1 year later, and she actually has no pain with her.